Hi Eric, my name is Jessica. I'm a student physical therapist. So I know you've been having some ankle issues, so we're going to do a couple of special tests today to see if we can maybe figure out what might be going on. Okay? So the very first thing that I want to do is called a figure 8. So I'm going to be looking at the amount of swelling that you have in your ankle. Okay? All right. So just go ahead and relax your foot for me. So I'm just going to use this tape measure. This is just going to give me a good idea of how much swelling you have, and I'm going to compare it to both sides. Okay? Okay, so left ankle is sitting at 47.5 centimeters. Okay, so what we would do is we want to make sure that we're checking in on both sides to see if his other side should have less if he's super swollen on the left side. So we would want to measure both sides, that way we can compare it down the road to see if that swelling has gone down, because his right side would actually be our baseline. So, be great. Okay. So now we're going to do what's called a squeeze test. Okay, I'm going to put both of my hands around the sides of your calf, and I'm just going to give it a gentle squeeze there. This test is to see if you might have what's called like a high ankle sprain. Okay. All right. Squeeze here, squeeze. Okay, so a positive test would be reproduction of pain at the ankle. This is looking again for a high ankle sprain, mostly of those structures kind of where the tibia and the fibula meet right in between there. So if this was a positive test, he would have symptoms at the ankle. So, okay, Eric, so the next test that we're gonna do is called the anterior drawer test. So this is looking to make sure that your ligaments on the outside of your ankle are intact. Specifically, the ligament that we're looking at is the anterior talofibular ligament. So what I'm going to do is I'm going to hold here, and I'm just going to give you a quick pull up, and we're just going to see what that feels like. Okay, and you let me know if you have any pain. Okay? Maybe a little pull. So a positive test would be laxity at the ankle or reproduction of pain. And again, this would be if there was some sort of compromise to the ATFL ligament. This is something that you can definitely test bilaterally to see if he's got the same kind of symptoms on this side. May not mean that there is a rupture in the ATFL, he just might have lax ligament, so it's good to check it bilaterally. So the next test is also going to be looking at the integrity of the ligaments on the outside of your ankle. So the very first one is going to be an inversion stress test, okay? So the ligaments that I'm going to be looking at mostly are going to be like the ATFL that we just talked about. So this little guy right here. So what I'm going to do is I'm just going to hold on to your ankle, and I'm just going to move your heel in a certain direction, okay? And I want you to tell me if you have any pain, all right? Okay. There's good. Inwards a little bit. Okay. So if this inversion stress test was positive, it would reproduce pain right along the lateral ankle. This would indicate that there was like a disruption or a rupture to the ATFL. The other test that we can do is called a tilt test, a Taylor tilt test. And so what we're going to do for that, right there, for me, bring it in, and then same position. Good. Okay, so if that one was positive, again, it would reproduce pain in the same area, but it's also looking at the integrity of the calcaneofibular ligament, so it's going to be a little bit more on the backside of the ankle here as well. Okay, and again, you can test bilaterally to make sure that it's not just lax ligaments on both sides, but a positive test would be reproduction of pain or symptoms. So last test, now that we've ruled out any sort of ligament involvement, I just want to check quick mobility of your ankle joint and see how well that's moving. Your ankle joint has to be able to move in a variety of directions for you to move your ankle. So the position that I'm going to be looking at is a posterior glide or anterior posterior of the talar curl joint. Okay. Relax your foot for me. Is that okay? Mm-hmm. So I'm just doing joint mobility assessment. So I'm going to push all the way down. I'm not doing any sort of grade really. I'm just seeing how well it moves. So he's a little bit stiff. The further I go, a little bit stiff there. So again, I'd want to test this bilaterally to make sure, I mean, that might just be his normal range of motion. If he is really hypomobile, that's going to contribute to loss of dorsiflexion. So we're going to check this on the other side as well and compare. Relax. Is that okay?
Mm-hmm.
Any pain?
Oh, no pain.
Okay. I feel like this side actually moves a little bit better. All right, so we'd want to test it. Normal mobility should allow him to have full range of motion into dorsiflexion. So if he's limited with his dorsiflexion range of motion, it could be because he's got limited posterior glide of the talar carpal joint. So there we go.